Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. Patients often ask us that they have missed their period, but their pregnancy test is negative, or their periods are delayed and their pregnancy test is negative, and so they are confused. I'm going to help you understand the situation in this video. There are many reasons because of which you might have a negative pregnancy test, but you may still be having a late period, or you may have missed your periods. Amongst these are situations like stress, the hormones which the body uses to combat with stress, health conditions, infections, and several other factors which could be affecting your cycle. So I'm going to go into each of them in detail so that you will understand and maybe you will come to know what is the actual cause for this situation. The first thing that you need to understand is that a change in the expected time of your cycle by around 4 to 8 days, that is plus or minus 4 to 8 days, is even considered to be normal. So this much variation may have even happened normally if you have only missed, if you haven't had your cycle maybe between 4 to 8 days when you expected it. You can just wait and see if it arrives, or if it has just come a little bit late, you don't need to be very concerned. The other thing to remember is that as your age increases, this variation, the period of variation, is even more. So for women who are older, maybe even above 35, coming closer to 40, even a change or a variation in the cycle expected time of even up to 12 days is also sometimes could be normal, and it doesn't mean that you have to be concerned just because you have tested negative for pregnancy. So a normal variation in the cycle is in itself one of the causes for this. So that's the first thing that you should remember. If that has been ruled out, I'll explain to you the other causes. If you are sexually active and you are expecting or you're trying for a pregnancy, one of the reasons because of which you have tested negative is because you have tested too early. It's important to note that even the blood test for pregnancy, which is the beta HCG blood test, is only positive around 10 days, but usually around 2 to 3 weeks after the conception has taken place. So if you have tested before that, you might still be negative, but then later on you have missed your period. So the best way to solve this is to actually repeat the pregnancy blood test, preferably from the same lab where you did it before, so that you can compare the values and you can then check whether you're really actually negative for the pregnancy test, and you rule out the fact that you could have tested too early the first time. Stress in your life, weight changes, eating too much, eating too little, exercising, any kind of heavy stress on your body can all completely derange your cycles. Cortisol, the hormone that our body uses to fight stress, can itself delay your periods. Women who have been under situations of tremendous emotional and mental stress are known to have missed their periods only because of this. So you need to be sure that you haven't suddenly put on a lot of weight, you're not eating a lot suddenly, or you haven't suddenly stopped eating completely. You haven't gone through an extremely stressful phase in your own life, because all this could be contributing to your delayed period or missed period. Then we come to certain health conditions or medical conditions which could be disrupting our cycles. In this, I'm going to tell you about PCOS and thyroid. PCOS is a situation in which there are these fluid-filled spaces in your ovaries. Your ovaries are two organs on each side of your body, just below your stomach, and their job is to release the egg during each of your cycles. In some women, because of changes in the body, maybe because of eating too much, maybe because of putting on a lot of weight, the ovaries develop these spaces or cysts in them, and because of this, ovulation does not take place normally, or you have missed cycles, delayed cycles, your cycles are irregular. This is one of the reasons because of which you may have missed your period, or it may be delayed. The way to check this is by doing a series of blood tests. I've made a separate video on that. I have included a link in the description. Please check that out. Next, but a very common cause, is a thyroid problem. If you are suffering from a situation where your thyroid is not working properly, or your thyroid is overworking, this can cause your cycles to get deranged. And this could be the reason why you have missed your period or your period is late. The best way to check this is by doing a simple blood test called the TSH test. Just get this blood test done. If that value is normal, you can rule out thyroid as being a possible cause. So what should you do next? I've just given you some of the possible causes because of which you may have this situation where your pregnancy test is negative but you have still missed your period. What should you do? The first thing is consult your obstetrician or gynecologist. They are best placed to figure out what is going wrong. The next thing you should do is that if you're expecting to conceive, you're having pain, you're having heavy bleeding, anything like this which looks like it's an emergency, definitely immediately go to your obstetrician. it could be a sign of a very early miscarriage in case you are already pregnant. Or it could be a pregnancy which has taken place in the wrong part of your uterus instead of the usual place. It has taken place somewhere else and it is now causing this problem. Not only this, you might be even having something like an infection like tuberculosis, you might be having an STD. Any of these things can cause damage to your reproductive system, and it could be giving you this strange situation where you're not pregnant but you're having no period either because of certain problems in the reproductive tract. So you should get all this checked. Definitely repeat your pregnancy test because that is one thing you can do, but consult your doctor.